Board of County Commissioners Board Work Session. It is Wednesday, February 9th, 2022, 3:05 p.m. For public attendance, you may follow along on the Thurston County YouTube channel or join by calling 360-252-9020, PIN number 1234. I am Carolina Mejia, Chair of the Board. I am joined by Vice Chair Ty Menser, as well as Commissioner Gary Edwards joining us from the boardroom, along with County Manager Ramiro Chavez and Assistant County Manager Robin Campbell, as well as staff members from OlyMAP and county staff joining us via Zoom. Today, we will be discussing OlyMAP Scatter Site Pilot Program Update. And I am handing this off to you, County Manager.
Yeah, this is an informational briefing, commissioners. And as you may recall, you authorized a pilot program last year called the Scatter Site Program. Since the approval of that, some things have changed, obviously, as we know. And this will be a good opportunity to hear from the contractor, OlyMAP, as well as from Keely and Tom, as to how the project has evolved, some of the successes, perhaps, and perhaps some of the opportunities from this point forward. Keely?
Yeah, they have so much good information. I'm just going to take this moment to introduce you to Keely Marino, first of all, with the homeless coordinator for Thurston County Public Health and Social Services. And I'm just so eager to pass this off to our presenters. So Tyler Gundel, the program coordinator for Olympia Mutual Aid Partners, and Jenny Milchenko, who is all of the data and all sorts of other administrative support and beyond for Olympia Mutual Aid Partners. So I want to turn it immediately over to them to maximize their time.
Great. Thank you, Keely. And just also quickly, thank you all for making the time to hear from us. Really glad to have the opportunity to share some of this with you all. So with that, I'll go ahead and get started and mention this to Manager earlier, but the PowerPoint we're using, as it's a shorter presentation for us, will be the version we used for the RHC, so not the longer presentation that y'all may have been sent already otherwise. So with that, so as you all know, the Scattered Site Pilot Project really came about in response to the reality that we do not have sufficient shelter or availability of shelter or housing in our community. And as well as we have continued to see increases in people living unsheltered as a result of that. Most of these spaces where people are living unsheltered have very limited access to support and services. And of course, in connection to that, we've seen continuing and escalating impacts across our county in relation to camp communities. And the historical response to the increase in folks living unsheltered has most often been to rely on displacing folks from those places, even when there's not necessarily another place for those folks to go. And as we've seen in our own community over the last several years, that response has not necessarily proven to be an effective way of addressing the challenges that are most often associated with camp communities. So with that context in mind, one of the main intentions behind the Scattered Site Pilot Project was really to pilot an alternative, more effective and more humane response to unsheltered homelessness, and also more effective methods for mitigating the harms and impacts associated with camp communities. The Scattered Site Pilot Project is also grounded in what we often call a shelter-in-place approach, which essentially means working with unsanctioned camp communities to improve site safety, stability, health, security, where people are in the absence of more appropriate and ideal shelter alternatives. So we were contracted with Thurston County to carry out the case management, site support, and collective management aspects specifically of the Scattered Site Pilot Project. And simultaneously, the City of Olympia was contracted to oversee site maintenance. So garbage, restrooms, that kind of stuff. So the overall goal, again, being to improve camp stability, health, safety, and connection to important services where people are in the absence of other housing and shelter opportunities. And the program that we proposed and that we were contracted to carry out was informed both by similar regional projects like those in Seattle, and also our own experience providing support to local camp communities really since 2016 in this community, and particularly the Nickerson camp located on Wheeler Avenue, which is a camp that we've supported using our model since 2018. And just a little more specifics for what we were contracted to do. So we were contracted to work specifically with 3 unsanctioned sites in the city of Olympia, the former Deschutes Parkway encampment, where, as you all know, most of the folks that were displaced from that camp are now staying between a couple of hotels in the region, with our workers continuing to provide some support there. We're also continuing to work with folks living along Ensign Road and Nickerson and Wheeler. And throughout the time of this project, there's been roughly 175 to 200 people living between those sites. And then just a little bit of a better idea for how we provide our day-to-day services. We take a team-based approach to providing support at these sites. So we have a team of 3 dedicated to providing support at each site, with 2 mobile caseworkers who are focused on providing intensive case management services, and then 1 site support worker whose role is to really work with the camp community as a whole to improve site safety and stability. And there I'll turn it to Jenny to talk about some of what we've accomplished over the last couple months.
Great, thanks, Ty. So we just want to share that since we started this project in July 2021, we have had interactions and worked with over 180 individuals, which is honestly pretty amazing given the fact that, we estimated that there were about 175 to 200 folks in those camps. So we really have been able to interact with and really work with a majority of those folks. So, and you can look at the numbers. So 76 folks from the former Deschutes, about 49 from Ensign, and about 45 folks from the Nickerson Wheeler encampment. Great. And then next, I'm just going to share a little bit more about our case management program, what that looks like, and some of the data that we've gotten from the first 6 months. So basically, I know a lot of us are aware of what case management is, so we're not going to focus on what is case management, but we will talk a little bit about what makes us unique from other programs. So our case management program is entirely outreach-based, which you may have inferred from the mobile outreach worker name. So all case management happens on site. We have site support workers and case managers that will go out with canopies, set up, be doing appointments there all day. Sometimes they'll do them on the steps of an RV, on the back of a car, basically anywhere that works for the participant. So we meet them where they are, both literally and figuratively. We also can work with any demographic. Our funding isn't tied to a specific age group or type of experience, such as domestic violence or working with veterans. So we're really able to work with anybody. And also what's really important for our program is we're very, very low barrier. The only things that we require for folks to engage in case management is that they're a resident of one of the sites that we're contracted with, that they're willing to work on goals together with an OlyMAP caseworker. And then also, unfortunately, we only have 2 case managers per site, as Ty mentioned. So the amount of people who want case management greatly is much higher than the amount of services we can provide. So we have a wait list. So in the meantime, we do have to prioritize folks based on their vulnerability and other risk factors. So just a general overview, since we've started, we have provided case management to over 65 folks through the Scattered Site program. As of December, we have 63 enrolled currently, with 28 at Deschutes, or now mostly working out of the Super 8 motel. Ensign Road, about 20 folks engaged, and Nickerson Wheeler, about 15 folks. And I'm not going to read through all of this, but just to give you an idea of what intensive case management includes, it's a very wide range, a lot of it very traditional, connection with housing resources, making sure folks are in coordinated entry, and then, mental health, substance use, anything else folks desire to be involved with. So we try to have a lot of rounded services. One of the things that we are tracking with our case management is the number of referrals and the type of referrals that our case managers are doing. So we say referral is anytime one of our workers refers a resident to any other kind of service that's external to OlyMAP. So between mid-July and mid-December, we've had about 248 separate referrals. So looking at the numbers, about 50% of all the referrals came from the former Deschutes encampment, and about 21% of those were from Ensign and 29% from Nickerson Wheeler. And then if you go ahead and look at the graph, you can see that our referrals are grouped by categories. So looking at the highest or the most frequent types of referrals that were requested by residents is, housing related things, medical related things, and then basic care and hygiene. And so what's really important, and we don't have time to show the data for all the sites, but basically across all 3 sites, these 3 areas, medical, housing, and basic care, were like the most common types of referrals, which really to us showed that what people are looking for first and foremost is to get their basic needs met before they're really able to engage with more complex needs, such as looking at their substance use disorders or looking at any sort of mental health things that might be going on with them. We also track service applications. So any sort of applications our case managers do, whether that's Social Security, food stamps, a housing application, housing voucher, HEN, there's plenty of forms, as I'm sure you're aware, things to apply for. So we also took count of that. And one thing that, or 2 things really, that is very, very consistent across all of our sites is the main applications that people really needed and wanted were replacement phones and getting their IDs replaced. Both of those are extremely, extremely important for just meeting basic needs in terms of having a communication so that they can get connected to caseworkers, check in on job applications, set an alarm for waking up on time to go to an appointment. So those are really the first and foremost things that people were focused on. And you can see as well that we've had, again, Deschutes was the site that had the most applications complete, followed by Wheeler and then Ensign. We also have, so apart from intensive case management, so unfortunately, we have a cap on how many folks our case managers can work with, just so we can try to make sure our caseworkers are taking care of themselves and are not too overwhelmed. So we offer a separate service that isn't quite as intense as case management. So it's something that we call a basic connection. And it's similar, but it's less intensive, and it's meant for more simple processes that don't involve several follow-ups, just a one-time thing, such as a phone application, such as getting an ID replaced. So out of all of those, we've had 63 basic connections. And like I said, a vast majority were for just phone replacements and ID replacements.
Thank you, Jenny. So I'm going to go ahead and start doing a little background about our site support and collective management part of our program. So the site support, the overall goal of that program is to support the camp residents and camp communities to provide and improve general stability, health, and well-being of the camp communities we work with, and also the other main part of the goal being to work to improve the relationships between camp communities and their housed neighbors by focusing on conflict resolution and problem solving around some of the challenges that come up that do impact neighbors in the surrounding community. But the really overall goal being to support the overall health, safety, well-being of the entire community. And I also want to take just a minute to share a little bit more about what collective management is, as it's probably the part of our program that most folks are unfamiliar with. The collective management model is a model that is unique to OlyMAP. And using a collective management model, camp residents democratically develop and implement a vision, values, community agreements, and processes that address the challenges that come with living in a camp community. Non-resident staff like us at OlyMAP assist with facilitating this process and also support the operations. Self-governance, even though that's like a critical part of collective management, is just really one part of the collective management process. For collective management to really be successful, it really requires the collaboration and partnership of all who are impacted by the camps, including neighbors, landowners, and those groups as well. And then just to give a little bit of an idea of what the development process looks like for collective management, it usually takes anywhere from 9 to 12 months to put a collective management process in place at a camp that we're just starting to work with. So we start with relationship building rapport and trust, getting to know the camp, letting them get to know us. And then the next part of that is both working to do what we can to help meet people's basic needs at the site and connect folks with essential resources, because as Jenny mentioned earlier, what we've seen is folks really need to have those basic needs met before they're able to focus on things that are a little bit more complicated, like coming together with the rest of the community to create a vision for what they and better ways for living together at the site. But that is the time where we do start doing some of that community visioning work with the residents. And from there, it's usually the point when we start having regular community meetings, and we work with the residents to develop community agreements and processes. And then once we have those determined, work with the residents to implement those processes. And so these are some of the basic conditions that are really essential for collective management to work. Again, people need to have their basic needs met, or at least that greatly helps with the process. Trust, genuine and strong trust between us and others who are involved in the process is really critical. Partnership and collaboration with neighbors and stakeholders. Relative community stability, obviously there's always some level of instability at unsanctioned sites, but the more support and stability we can provide, the more likely it is to be successful. Openness to create creative and resourceful solutions, and then also some level of site control, or at least control over the process. So for example, limiting outside interference with the building of the collective management process, and support of our partners and stakeholders in that process. And then these are some of the things that we expect to see come out of a collective management process. Again, codes of conduct, admission processes, accountability processes, decision-making, and community meetings. A quick example of a place that uses collective management, I mentioned the Nickerson encampment earlier. The Nickerson camp is a camp that's been in place since around 2018 and has been using a collective management model since then. So this site, which is supported by OlyMAP and also partnered with the local faith community, has formal admissions, formal accountability processes, weekly meetings that they've had for over 3 years. The population has stayed relatively stable and has been consistently recognized as the cleanest, most organized, and stable unsanctioned camp in Thurston County. And then I turn it back over to Jenny to talk through some of the barriers and challenges from the last 6 months.
Thank you, Ty. Yeah, we are obviously very excited about the successes that we have had, but there are some setbacks and challenges that we have had as well. So the first one is a crisis-driven approach. We've had a lot of challenges with a lot of things happening in our community. I think we all know that there's a lot of moving parts, a lot of crisis, and making decisions in a crisis-driven atmosphere makes it so it's harder to make sure we're making those decisions collectively and collaboratively, and making sure we have the time to think through all of the possible repercussions from our decisions. You know, a lot of crisis in our day-to-day work with individuals that we're working with in the camps, but also camp-wide crises, which brings us to the next barrier, which is sweeps. So just so we all have a common language, for us, we define a sweep as displacing an unhoused community when there's no appropriate or legal alternative location for people to move to. So unfortunately, because of the full sweep of Deschutes and the partial sweep of Upper Ensign, over half of the participants that we've been working with on the scattered site project have been scattered or displaced, which is very frustrating and discouraging for our staff, especially for the Deschutes team. As we mentioned before, we do have folks staying in the hotel, but that's also a temporary situation. And our workers have just been working really, really hard to mitigate these unforeseen circumstances. So the next barriers is we have noticed that there are some conflicting goals and expectations between us and some of our partners in the project. For example, we didn't really come and meet beforehand with our partners to really dive deep and make sure that we all had the same goals and expectations, especially around not having clear expectations for how we're communicating and making decisions that impact the site control, which leads to the next challenge, which is that even though we are contracted to provide site stability and collective management for these camps, we don't actually have any formal control or authority to make or enforce decisions regarding the site and the site management. And as we've seen, this has had some devastating consequences for the efficacy of the pilot program, since we are supposed to be studying how to stabilize camps. You can see how it's kind of contradictory to displace them. So that's been a very large challenge. And then the last one, but certainly not least, is staff burnout. Anyone who has worked in social services is aware that even when we aren't in a pandemic and there's plenty of resources, this work is very difficult, it's challenging, and it's often overwhelming. And so as of now, Our staff have worked incredibly hard to keep our program afloat and continue to support our residents, even when we've had a lot of unintended things happen. And so our staff are exhausted and just really overwhelmed by the sheer amount of crisis that's happening on a daily basis. So it's also unfortunate that we haven't quite had the capacity to support our staff in the way we would like, which has exacerbated the strain on us individually and also as an organization.
Thank you. So really, despite some really significant successes and things that we're very excited to see happen over the last 6 months, we do believe that it's critical that we address some of the existing challenges in order to make sure that, one, the project stays sustainable, but also that it remains in alignment with the goals and expectations of this project. And we do see that there are very practical and attainable steps that we can take in order to ensure that, and really are hopeful that that's going to be possible. So just to quickly go through some of those, these are our priorities for things that we would like to see to help assure the success of this program. So developing a better shared understanding of the goals and priorities of this project, strategizing for actionable and attainable ways to prevent continuance of a crisis-driven approach, clearly delineating roles and expectations of project partners, especially when it comes to site management and collective management. Expanding site support partnerships, especially with faith communities and other organizations, with the intention of trying to actually identify and designate more appropriate places for people to go. Implementing a more effective and process and management process for garbage removal. That's also been a shortfall of the project. Supporting safety and sustainability for both OlyMAP and City of Olympia program staff, and also working to develop a more unified narrative about the project and increasing public communication about what we're seeing and dealing with on a day-to-day basis. So with that, we will wrap that up and happy to take any questions folks might have.
Can you stop sharing your screen, please?
Yes.
Thank you.
Thank you so much. Okay. Questions, Commissioner Edwards?
Yes, I have no doubt that there's a lot of folks that are attempting to do a lot of good things. Your heart's in the right spot. I know you're trying to bail a lot of folks out of a bad spot. But how much is this costing the taxpayers? I see that over the last 5 years, this problem has expanded 95% for your material. So how much has that cost the taxpayers to cover all that?
So with our specific program, that's funded through this year. It was about at $600K, but for what we were looking at, for for what we've seen of this project has only been in place for the last 6 months. But very honestly, it's probably hard to measure the cost of how much tax dollars and all of that has gone into a homeless response over the last decade. Absolutely, it's been a lot for outcomes that the public may not see as enough. It's a really complicated situation and absolutely has a high cost for our community. And that's one of the reasons why. Oh, sorry. Go ahead.
No, I was just going to say I guess I can't expect that you would know the dollar amount completely. But it is millions and millions of taxpayers' dollars that have went into a problem that now is 20 times more of a problem than it was 5 years ago. And so my take on this, there's only so much room in the lifeboat. And if you put too many in the lifeboat, the whole program sinks. And until the City of Olympia makes a decision that they're going to quit enabling deviant behavior as a normal lifestyle and not encourage people to come here from all around the United States, we're just never going to get a handle on this. So I applaud you folks for doing all the hard work that you're putting into this. But until somebody comes up with some sense, I'll say common sense, and decides to hold people accountable for their inappropriate life choices, we're just not going to get it solved. I mean, it's a moneymaker for somebody, And I'm not being critical in saying that, I'm just a realist. That until we decide to hold people accountable for their deviant lifestyle, then we're just not gonna get there. And no matter what, you guys are beating your head against the wall, and I feel sorry for you in that regard, because I know you're trying. I know your heart's in the right spot. But we need to have some tough love in here. And more than half of these people are from elsewhere. I know when you folks ask them as social workers, you know, where are you from? Oh, we're from Lacey or Grays Harbor or Yelm or wherever it is. But when the authorities intervene and we have a serious medical issue or a serious criminal issue in which folks finally find out where they're from elsewhere. We can't have that many people that are bad people. It's just that they congregate here. So we can take care of our own, I truly believe that, and you folks would be able to do great work and solve a lot of problems, but not until the city of Olympia decides to make a philosophy change. So that's kind of where I'm at. I know I kind of throw in cold water on a great program that you folks are working on, but I'm the realist, I think, in the room. So thank you for all you do.
Yeah,
That's it.
I mean, oh, sorry.
No, I was just gonna say that.
I just want to respond briefly. I think we can agree with you that just solely the local response definitely is not enough to solve what is going on. You know, part of our longer presentation was really putting the context of homelessness, both nationally and also in our state. And I will say, you know, it is really expensive. It's always really expensive when, like what we mentioned, we're working kind of like consistently responding to crisis. We're working in a reactionary mindset. With my perspective of public health, that's where my degree is. We always talked about how when you go upstream and you put money in prevention, you're saving so much money by preventing. But I think the thing is the complication is, how do we find a way to get our societies focused on prevention and looking at those upstream factors that are leading to these problems and this expansion of homelessness in our community? I can't speak to people's personal decisions or where they're from, but yeah, I mean, I agree that the way that we have been working certainly is not having the outcomes that we want. And it is often just putting Band-Aids on things, you know, and it's exhausting. So
I just have to throw in on your comment that this extremely low barrier that we require folks to live under, those type of restrictions, that's what's dragging us down. We need to hold them accountable. No dope, no drinking, no smoking. They wouldn't do anything if they're going to stay here. And then we'd help them out and we'd get them in treatment, mental health treatment, drug treatment, and force the treatment on them. If they don't want to be forced into that treatment, they can go elsewhere. And they would. I've seen it happen in other places. So, Centralia down there turns a sprinkler on every 2 hours in their city park. It keeps deadheads from parking down there. Okay, thank you.
Thank you. Okay, Commissioner Menser?
Just a question about the original, you made reference to original goals and expectations. And I understand that I understand how like a sweep would be disruptive. You know, you put a lot of effort and work into trying to develop stability, but we had an Ensign Road update that Keely gave the Board of Health on yesterday afternoon. And she was describing the evolution of how we got to where we were with Ensign Road. And she was talking about how we were scattered site kind of came out of our failed effort to find a place to move the RVs originally. And then we ended up deciding, well, let's do this scattered site pilot. And Keely said, and I wrote it down, she said the goal was to fast track people into other options. So I just wonder about that, because you're describing a situation where you're trying to build stability and safety and all those things into these camps. And I understand the importance of that, don't get me wrong. But at the same time, you might be butting up against policymakers that were believing that this was kind of the very nature of it being a pilot, the very nature of it being a pivot from a different program that we were hoping to move RVs to somewhere more logical. the fact that we were hoping, and again, I knew that goals like that are difficult, right? If we had easy places that people could go, we probably wouldn't have the situation to begin with. So I understand, I would not be expecting that everyone was fast tracked into another housing option. But with that being an upfront goal, there's kind of a tension there between you guys trying to build, relationships and security and governance and all this stuff. And then, we as the county commissioners or city council are like, we want to get people like not necessarily dispersed into hotels or other homeless situations, but into more stable situations. So I guess I'm just wanting to kind of throw that out to you guys, that I'm with you on one half of what you're saying about let's have this shared expectations, but there is a tension there because we'd like to not have camp. I think we're trying to evolve toward a situation where we don't have camps at all.
Right.
Just wanted to throw that out.
No, thank you. And that's one of the things that, we were for the longer presentation really hoping to get to go into more for an understanding, because really that's not in conflict with our goals. We actually see the part of like creating stability where people are when they're there actually really supports people in connecting to those services. And that's why we kind of take that two-pronged approach where the site support and supporting, increasing stability and health and safety where people are in the absence of more appropriate alternatives, right? So that doesn't mean that the goal is to keep folks where they are. The goal is to make, in the absence of other alternatives, the situation as stable as possible so that, for example, our caseworkers can more effectively work with the people there to connect them to other services. It's kind of this similar twisted version of housing first, right? Where we think of, for folks to be able to address those other long-term goals, they need to have like the stability of a roof over their head. And of course, a camp is nowhere near close to that type of stability. But when somebody at least has a consistent place to stay, access to a dumpster, a restroom, social workers coming on site, it's a lot easier to like stay on track with meeting those goals and get fast tracked into other options rather than when we have social workers trying to chase them around town all the time because they're moving place to place. So we really actually see them as complementary and share the goal of wanting to see people transition into more appropriate alternatives as soon as possible.
Thank you. That's all I have.
Yeah.
Thank you so much again for coming and doing this presentation. I am a member of the RHC, so I had seen both of you at the previous meeting, so I appreciate everything you're doing. Okay, with that, if there's no additional comments, we will adjourn. Thank you again.
Thank you.
Thank you.
We appreciate
Yeah,
that.
thank you.
Did you get it?